Very important. Last week, you spoke with the Surgeon General of the United States, Jerome Adams, and it was a fantastic interview, very informative. Zpryme will provide a link to in the show notes to that interview. And the Surgeon General mentioned 3 steps that every individual can take to protect themselves against coronavirus. Can you share his 3-step prescription for approaching social distancing and how it works?
Well, the big thing that he talked about is know your risk. And I had just mentioned that, which it's really, who's at greater risk? If you're elderly, if you're immunocompromised, if you have diabetes, heart disease, high blood pressure, respiratory disease, you want to have those other precautions. You want to be a little more vigilant and a little more aware. He and I talked a little bit about control, what you can control. There's only so much that you can do, but you can do things in your own home. You can do things in your own community. And we also talked about knowing your circumstance. So, I don't know what your particular circumstance is in your home, but I know what mine is. As a healthcare provider, I still saw patients last week in clinic. I need to know what, my circumstances are in terms of, my potential, risk. So that's, important. And then you want to, take charge. You want to take control of what you can do and take action. So that revolves around, your risk. Okay, maybe you're immunocompromised, your circumstance of who you're living with. And then what are you going to do about it? You're going to be even more vigilant about certain, hygiene and social distancing. And that's, I think, people want to know what they can do and control what they can. So it was a very important message. And the Surgeon General is very well intentioned and really trying to, protect the lives of Americans.
Yes, I think his work and Dr. Fauci's work and so many other federal public health officials and then down to the state and county and city level have done really a tremendous job trying to inform people and keep them healthy. It is a very empowering message too. So much of the concern around what we're seeing with COVID-19 and coronavirus is this fear and this uncertainty. And having a 3-step prescription for what each individual can do is something that is very empowering and reassuring. Unfortunately, so after he had that great interview with you just on March 23rd, the Surgeon General then said, I want America to understand this week is going to get bad.
Yes.
And so, and in that reference, he's talking both, unfortunately, about fatalities due to the disease and then the continued spread and more people becoming infected. How much at this point of the rapid growth in new cases is a result of more test kits being available to people, and how much of it, we don't know for sure, but how much of it is just that test kit finally coming to the market?
Yeah. Well, I think there's a recognition that we have community spread in most areas of the country, some more than others. And again, if we think about that curve from the time when you institute some mitigation strategies to where you're going to see this, increase of cases, that's probably where we are this week and next week. Absolutely, it's about testing. If you don't test, you don't know if you have cases. But remember, we have now over 300,000 tests that have been done. It's probably a little higher because it doesn't include some of the labs at local hospitals. And we're only now starting to do about 10,000 tests a day, whereas in South Korea, they were doing 20,000 tests a day from the very beginning. But remember, of those 300,000 plus cases, we're still really only 10% are testing positive, and we're trying to test a population that perhaps is at more risk. So if we think about where we are in those curves that everyone is talking about, this is where if we've had community spread for a significant period of time, which we probably have had, and we have an incubation period of 14 days, and we really just started the mitigation strategies, really on March 16th, and when the president really instituted this 15 days to stop the spread, we're going to see increased number of cases which include, if we say 10 to 20% or more severe cases, we're going to have some complications that are going to require hospitalization. So honestly, it's not surprising where we are today for those that, think about epidemiology and think about public health, but it is going to be concerning for the public to hear. But I was so glad he talked about that because it's about managing expectations. So he's letting you know ahead of time, this week's not going to be so good in terms of the number of cases and what we're going to see. But the good news is, Dr. Fauci, who we all have a lot of respect for, talked about he doesn't think our slope is going to be the slope of Italy. And the reason
Mm.
why he has said that is the Italian population tends to be older. They tend to have a higher incidence of smoking and obesity, believe it or not, more obesity than in the United States. And they implemented some of these mitigation strategies later on in the process. So, this week is probably going to see a lot more cases that we've already seen. We're going to see more deaths. That's just as a general rule in terms of the number of cases. And really, I think by the end of the month, we'll have a much better sense of where we are in combating the virus.